Phobias are a special type of anxiety disorder. So to understand what phobias are, we really need to understand what an anxiety disorder is. Of course, an anxiety disorder is more than just being worried or anxious about something. Perfectly normal to become anxious under some stressful situations, be it things like an exam or a test, a job interview, or even having a medical appointment. In all of these situations, the next few minutes could dramatically alter the rest of your life. So it's perfectly normal to be concerned about the outcome of such an event. It's also important to realise that anxiety disorders have their roots in our survival instinct, just that they just go that bit too far trying to protect us. Anxiety disorders are not these kind of one-off events, or even a relatively rare occurrence for the person who has them. It can be a constant feeling of being anxious in what's known as a generalised anxiety disorder, which is a long-term condition where the person spends a lot of their time being worried in general, rather than being worried about any specific event or item. This of course has a dramatic effect on the person, including fatigue, sleep problems, headaches, heart difficulties, and other stress-related symptoms. Alternatively, the disorder can be more focused in the case of things like phobias and post-traumatic stress disorder. With generalised anxiety disorder, though, there isn't a single root cause, but it can be affected by genetic predisposition, childhood trauma, experiences like drug misuse, or an imbalance of chemicals in the brain like serotonin. With post-traumatic stress, there's normally a source of near-death experience, such as a car crash, military combat, or a natural disaster. Most critical life experiences, the brain will go over the precise details of the experience so that it can learn from the experience, be better prepared if the same or a similar situation occurs in the future. Unfortunately, in the case of PTSD, experience can be relived in the form of nightmares and flashbacks, making sleeping as well as concentrating during waking hours very difficult. Additionally, these experiences can be combined with survivor's guilt, which may compound the issue. Now, due to the way the brain works, this kind of reviewing of past events can occur months or even years after the events, and at random and unpredictable intervals, may lead the person to be on edge, fearing that another event may occur at any time. Now this, combined with lack of sleep, may make the person prone to angry outbursts. They may also try to numb their feelings with alcohol or drugs, which generally only make the situation worse. Then we have phobias. Now, phobias generally relate to a distressing experience. However, like the other anxiety disorders, factors like genetics, chemical imbalances can also make someone more susceptible to developing a phobia. A distressing experience can be directly related to the phobia that develops, or it can occur at the same time as the exposure to the phobia. So, for instance, someone in childhood who's bitten or even aggressively barked at by a dog may develop a phobia of dogs. Alternatively, if they were distressed when they encountered dogs, they associate the feeling of being distressed with being around dogs and develop a phobia of dogs as a result. This association can be also if the child's parent has the same phobia. So when the child encounters the source of the phobia, they notice the adult's reaction and copy their behaviour. Alternatively, it could be the sudden appearance of something, say like a spider crawling across the floor. Initially, it isn't the spider that causes a distressing experience, but the sudden and unexpected appearance of that spider. However, after the encounter, the spider then becomes the source of the phobia. Now, the treatments for these anxiety disorders involve prescription medication to make the person more relaxed, along with behavioural therapy to recognise the anxious thoughts when they arise, take steps to reduce their impact. Sometimes you can work on being desensitised to the event or the perceived threat. Alternatively, you can attempt to gain control of events or memories, either working with a therapist or with a group of people with similar issues. As with many problems, the first steps in dealing with an anxiety disorder is to recognise that you have one, and then seek help in dealing with it in the appropriate manner.